Hi there, young lady. All right, all right.
So I just
Well, I'm glad I catch you. I'm glad you brought me over here.
Yeah, this is the one.
That's what us, or they don't feel comfortable going.
Yes.
They just don't feel comfortable.
Yes, I have to do the same thing.
And I got plenty of padding. There you go, that's better.
How we doing, guys?
Great.
Man, what a great crowd today. Yeah, this is awesome. Hey, so I just gotta give you guys a little heads up. If I'm gonna have to have my phone on loud today, because if it goes off, I might have to run. So my wife's pregnant. She's due May 11th. So she's about to burst right now. So she's like, make sure you got your phone on loud. So I gotta give everyone a warning. So if I gotta pull my phone out, I'm excused. Okay? Is that okay, guys? All right. So today we had a great program. Got a lot of information. Our goal is to try to educate you guys as much as possible. There's so much information here, so if you feel like a little confused about some of the things that we're going through, just make sure that, turn this thing down one second. Just make sure that that you guys reach out to the experts that we're going to be working with today, and if you want to ask them questions in a little bit more depth, one-on-one, so you can get some of those questions answered, because we are going to cover a lot. And so what we did is we broke this segment up into 15-minute increments, because there's so many different people that we're going to bring up here to introduce to you guys. So we broke it up into smaller increments, a lot of information, but we're going to try to give you guys a good breakdown of all the different services that are available. If you have any questions for our speakers today, their information will be in the back. Again, they'll be in the back as well. We're going to have a different format where we're doing a little bit more of an interview style. So myself and then Amanda from Seniors Blue Book is going to interview some of our speakers today with some of the questions that we get asked a lot by you guys, so we can help walk through that process with you all. So I'm going to bring Amanda up, and then she's going to introduce Sue Chandler, our first speaker today, and we'll get this thing started. So.
Hello? Oh, yeah. So anyone ever said when they give me a microphone that I kind of change personalities, so bear with me on that. How many in the group are familiar with the Seniors Blue Book? Okay, great number. How many of you actually know how to use it? Great question, right? So I'll give you a brief synopsis. The first half of this book is a great resource guide. It's where you're going to find places like Chelsea Place, Adult Day, hospitals, doctor's offices, podiatrists, things of that nature. The back of the book is where we allow you to compare home health, home care, and housing options, apples to apples. So these are our grids in the back of the book. A lot of the information that we're going over here today can be found right here. So I want to educate you on how to use this, so if you pick it up and you're in a crisis situation, you're not scrambling trying to figure out how to use it. Each of you are going to walk away with one of these beautiful books in your bags today. If this is your second or third time here, this may be your second or third book, and that's okay, because your neighbors may need it, your friends may need it, or you may lose it, and then you have an extra one, okay? So our first speaker today is a personal friend of mine. I'm going to bring her up. Her name's Sue Chandler. She's with Mederi Care Tenders, so let's give her a warm round of applause. Come on down. I'm going to sit next to my son.
I promise I wouldn't work. I was sitting on his couch.
And the light is not going to blind me over here. So Sue works for a Medicare home care company, and I'm going to ask her just a simple question to tell us about who is the right person for a Medicare home health care company, and what kind of services can you provide to them?
Thank you.
No.
Can you hear me? Okay. Normally I don't need this because I am loud with or without a microphone. So good morning, and thank you for this opportunity, and thank you for coming. So who is appropriate? Anyone who has a Medicare benefit is eligible for Medicare certified home health care agencies. So later in the day, you're going to hear from someone who's speaking about more personal care services, but the services that we provide under your Medicare benefit, there's 4 criteria. One of them is that you're homebound, and that's the one that gets everyone hung up. So I like to kind of speak to that a little bit. Sometimes I think people don't want our services because when they hear the homebound word, they think this is something that just the next step. The next step, next is a facility, next is, but what I like to tell everyone, the majority of people that come to us, and well above 90%, the homebound criteria, it's a temporary thing. You possibly have had some surgery, you've been ill, you've had an exacerbation of one of your disease processes. So the homebound is a temporary thing. On day 1, a nurse will sit with you and sit and write goals. And where do you want to get? So they work with you, and the goals are in your words. So the homebound status, is not something to fret.
And can you clarify, when you say homebound, that doesn't mean that you can't go to church, right, Sue?
No, actually, you can leave your house. What the Medicare's definition is that leaving your house is infrequently, and it's a taxing effort to do so. So sometimes you may have an assistive device, a walker or a cane from a disease or a surgery. Sometimes you might just need your daughter or somebody to help you. Again, it's a temporary status. So no, you can go to your doctor's appointment, you can go to church, you can get your hair done. Quite honestly, even if you have to drive yourself, that does not negate your homebound status. Now, if you're able to go out and drive and go to the club and play a round of golf, you're probably not homebound. But if you have no other option but to drive yourself to your physician appointment or to pick up your prescription or your groceries, you can still be considered homebound if that's a taxing effort and you're not out every day, all day, but you're out infrequently and for short durations. So one of the other criteria is that you're under the supervision of a Florida physician. So because we're skilled services and we're billing your Medicare benefit for our services, we work under the supervision of a physician. So we are going to want to work directly with whoever your primary care doctor is, or your surgeon, if that be the case, or your specialist, if that's who's managing whatever diagnosis is referring you to home care. If you don't have a physician, with Madeira Care Centers, we work with some of the community physicians who do home visits, and sometimes we'll have you partner with one of them, and they'll oversee your care. During the time that it's hard for you to get out to your doctor, or if maybe your doctor doesn't have an appointment available right away, and then they'll manage your care while you're at home, and then we'll transition you right back to your primary care physician. So,
And can you kind of go over who pays for these services?
So Medicare Home Health is one of the few Medicare benefits that's actually paid 100% by your Medicare, by Medicare. So we don't bill your secondary insurance, and there's no out-of-pocket cost. If you meet the criteria for Medicare Home Health, it's paid 100% by your Medicare benefit.
And also, can you tell me, do you need a doctor's order for this or a referral?
You will. So this is something that, if you feel like you have a need, you can call us directly. I've actually put a little handout in each of your bags that you'll leave with today. And it's just a little bit of the presentation and a telephone number. But no, you can call us directly and we'll help you facilitate that, or you can just call your physician and let them know that you feel like you have a need and that you could benefit from this, even for a short period of time. Sometimes people are on Medicare home health care for 2 weeks, and sometimes they can be on for several months. That's one of the things. There's no limit to the amount to your Medicare home care benefit. If you meet the criteria for home care, we set up your plan of care in 60-day increments. But if we see, coming up on day 50 that you're going to need what we call a recertification, we communicate with your physician and we recertify. And whether it's an initial plan of care or whether it's a recertification, it's still a benefit that's covered 100% under your Medicare benefit.
Sure, yes ma'am.
Is that all Medicare or just straight Medicare?
Okay, so traditional Medicare is what I'm speaking to overall. I will tell you that some of the replacement plans also have a home health benefit. Now, they may limit which agencies that you can work with. Different agencies might have contracts with different insurance products. And also, sometimes when you get to the HMOs, they actually have a little more say-so in the care. So under your traditional Medicare benefit, you're gonna decide you need the services, or your physician or the hospital. We receive referrals from many different locations, or even if you're an adult daycare does not negate your Medicare benefit. So somebody identifies you have a need, we usually coordinate that care directly with your physician, and a registered nurse will go out and do an assessment. You'll decide what services really are appropriate, what you need, and then we'll get orders from them and set up the plan of care appropriately. Sometimes with the HMOs, you have to get approval for each visit, just like with other private insurances.
I want to take audience questions at this time, though, because I know that your questions are very, very important to us. These are just some general questions that we thought of, so please do us a favor. Yes, ma'am.
What are the
Wait,
criteria?
let's put it on microphone so everybody can hear what you're asking.
So I did hear you, what the criteria? Okay, yeah, the criteria, again, is that you're homebound, and again, we've identified that can be a temporary status, that you have a skilled need. So you have a need for either nursing, therapy, speech therapy, and then we have support services. If you get one of the skilled, we have support services of a medical social worker, home health aide, or an occupational therapy that can come in, in addition to those initial services. So under the care of a physician, and that you've been seen by your physician. A couple years ago, they added a new criteria that's called face-to-face. So back in the day, your doctor might just order home care. They actually had to have seen you within a designated time frame now. But again, a lot of times we kind of work that out as we go. As if you know you have a need, reach out to your doctor and we can figure that out as we go. But those are the 4 criteria for Medicare home care.
Coming.
Wait. We're gonna give you so everybody can hear your question.
Do I have to call my insurance company to find out if I'm qualified?
Actually, I would recommend reaching out to your physician. Frequently, if your physician takes the insurance that you're on, they know the ancillary services, who supports that. So I think that you can, reach out to your insurance company and find out who their preferred providers for home care are, or who their in-network providers are, or your physician's office, either one.
Yeah, but I need somebody.
Right.
I need somebody to help me when I have my surgery.
Yes, so I would talk to the surgeon. I'll give you my card and I can help you kind of go down that path. I'll give you my card before I leave.
Yeah, because
Okay.
I have to have somebody to help me.
Yeah, I can help you figure that out. And a lot of times it's just communicating directly with your physician. Frequently the surgeons know when you're gonna need it and they will order home care.
Well, it's the surgeon, not the general practitioner that knows. It's the surgeon.
Right.
It's the surgeon.
Frequently a specialist will write for home care and it doesn't require your PCP.
Okay,
It's
we
not
have
the doctor, it's the surgeon.
Right. He can order home care as well.
another question over here.
Okay.
I know plans will vary from patient to patient, but is there a maximum for home care folks to be on site per day, per week, per month, etc.?
That's an excellent question. So Medicare home health care, just like your physician, the hospitals, the doctors, we're all being charged in this day of getting more for less. So, is there a maximum time? We're going in and doing a skilled service. So if you needed someone to come and stay with you for 4 hours, that's not what we provide under your home care benefit. If you're having an exacerbation of a condition and you need a nurse to come in, evaluate your medications, educate you on your medications, set up a safe medication system, or if you need wound care or you need physical therapy, we're coming in and we're providing the service and then we're leaving. So if you're not safe at home, what we do helps you to get there, but what we do doesn't from day one make you safe at home. So typically we would partner with one of the private duty home care agencies that I think you're going to hear from today. But again, what we do is more of a skilled service. So they may be there for an hour and leave. You may have a nurse there for an hour and a therapist there for an hour at different times.
And so their goal is to really train someone on how to do the services themselves, is that correct?
Correct. So if I can, do I have a minute to tell just a
Yes.
success story? Okay, so let me just give you an example. A gentleman who had congestive heart failure, had been in and out of the hospital. Congestive heart failure is one of the diagnoses that just kind of gets you cycling in and out of the hospital. You can apply this scenario to any diagnosis that we have in here. This is someone who had never been referred to home care. The cardiologist finally, when one of the account executives was in his office, said, okay, I'll let you go in and do home health care. They sent a registered nurse out that day. They got to his house, and he sits in what we kind of refer to as command central. It's got the remote control, lunch, urinal, everything right there for the day, so they don't have to get up and move around too much. When the nurse is sitting there doing her assessment, checking vital signs, she notices that he has a salt shaker with duct tape over half the holes. And she goes, "Did your doctor tell you to cut your sodium intake in half?" And he says, "Yep." And she says, "Is this your plan?" And he says, "Yeah, smart, isn't it?" And she's like, "Oh, buddy." Moves his little command central desk out of the way, sits a chair in front of his kitchen pantry, helps him to ambulate in there, sits him in front and starts educating him on reading labels, how to really calculate sodium intake. Gets physical therapy to come out to his house and work with him on strengthening so he's not sitting all day. Fall risk, checks the home for a home safety eval. Brings in occupational therapy to teach him how to manage his medications properly. Gets a safe medication management system with the appropriate pill box that he can do. These are all things that are appropriate under your Medicare home health care benefit. It's the big miss. I think people identify someone who needs physical therapy, and I think people identify someone who has a wound or someone who got a joint replacement, but what they miss is these people that are struggling with their COPD, their congestive heart failure, their diabetes. A nurse coming in and doing assessment and education on a Medicare recipient who meets the criteria that we discussed is one of your benefits, and that's the big miss. So if you know someone in your life that has that kind of is struggling and cycling in whatever diagnosis they have, they're doing an assessment. So just have that person communicate with their physician, and somebody could come out and help them. And really, it's all about helping people. That's what we do. It improves their lifestyle. It makes them more independent.
Questions?
Okay, well, thank you so much, Sue. If you do have questions for Sue, we have the salon open. If you have a private question for her, and she can meet you back there.
How we doing, guys? Some good stuff, huh? A lot of stuff. So I want to introduce Miss Jamie here. So Jamie is our administrator here at Chelsea Place for our private duty home care agency. And so I just wanted to share with you guys, just let you know how proud of I am of her. She's been with us she started with us at the ALF. How long ago was it? In May of last year, and then we had an opportunity for her to come on board our home care team in September, but we didn't really officially get started and licensed until about the end of November and early December is when we got started. But her and Chantel have together developed an entire team. We've got 18, 20 people now, and we care for about 20 people in the home. And and her and Chantel did this on their own. They literally put together the team, they put together the training and all that stuff, and so I want to give her a round of applause because she's done a great job all by herself. I've been trying to support her as much as I can, but we got a lot of stuff going on, but she's just done a fantastic job, and she just has a heart of gold. So that being said, she's actually going to ask me these questions today, so she gets to drill on me a little bit.
How is private home care different from Medicare home health?
So, I know there's when we think about what Sue was just talking about, and those services are so beneficial, and it's free. You know, so I know in our assisted living facility, you know, we a lot of times will encourage, you know, bringing in Medicare home health as much as possible because it's so beneficial, yet it's a free service to you guys. And so using it as much as possible is very helpful. But I know the biggest difference is that typically Medicare home health is going to be more of a short term. You know, it's a 30 to 90 day. Of course, there's recertifications and things like that depending on the need, but it's more of a short term goal, and it might be like 2 to 3 times a week, you know, in and out of the home for therapy visits and things like that. But it's a short term play as opposed to private duty, which is more long term. You're looking for an ongoing long term solution for someone. Another thing would be is Medicare is covered by Medicare certified home health is going to be covered by insurance, whereas the private duty agency is not going to be covered by Medicare. It's not a healthcare it's not covered by healthcare insurance. So and then of course they're going to provide in Medicare home health more skilled services. So there's going to be more of a skilled or specialized type service such as PT and OT and all the different things that she's talking about. So there's all these other diagnoses like COPD and congestive heart failure and all these other things that it will provide, and it'll be covered through the and it's more of a specialized case, whereas home care is going to be more for the homemaker companion, transportation, going out to doctor's appointments and things like that, general help in the home with the activities of daily living. So just one's going to be more specialized, more of a therapy need, and the other one's going to be more hands-on care.
What different types of private home care are there?
So there's 4 different types. So for those that don't know, there's 4 different types of home health agencies outside of Medicare. And so the state right now they have homemaker and companion services, which is going to be a less restrictive license. Then they have nurse registries, and then they have then really the third category falls under personal care. And so under that category, though, you could have just personal care and skilled care, and that could be under a home health agency license. So there's really 3 different types of licenses that you can get. They all work a little bit differently. Homemakers and companions are essentially the easiest way to think about that would be someone who's hands off. So they're maybe just helping out with meal preparation, transportation, doctor's appointments, things like that. Whereas then you have a nurse registry, and so they're going to be able to provide hands-on care. However, the only difference would be is that most of their employees are going to be a 1099 contractor. So depending on the company, each company is going to be a little bit different as far as how it's covered, but you'll just want to make sure that the 1099 contractors are insured themselves, or that they have insurance through the company somehow. Whereas a home health agency that is going to be providing personal care or skilled care services, all the employees are going to be W-2 wage earners. They're going to be covered by the general liability policies and the workers' comp through that company. And so the thing is, the difference between a home health agency between personal care and skilled care would just be more of, one's going to be assistance with the activities of daily living and hands-on, but on the skilled side, it would be more nursing services like IV therapy. You might have someone that needs an insulin injection if they can't give it themselves. Like if for instance you had someone that needed insulin, and we had to actually figure out what amount of insulin to give them, and then prick their finger and all that kind of stuff. That actually would require a nurse to figure out what prick their finger, figure out what their levels are at, and then actually determine what amount to give them. That would actually require a higher skilled, so it would require skilled nursing in a home health agency setting. So not every personal care, private duty home care agency is going to provide skilled services. Like for instance, I know we don't provide that, but we do work with a company that does provide that service. So if someone needs that additional level of care, we can refer to them for that assistance. So
Why would someone need home care services?
So typically someone's going to need home care services because of safety reasons. I mean, I think in most cases that's going to be your number one reason why someone might reach out and want home care, private duty home care. But then we also have just like well-being, just prevention. So maybe someone's pretty independent, but just more of a supervision / prevention type thing, where there's just oversight in the home to make sure someone's okay. The other one would be, maybe just transportation to and from doctor's appointments. Maybe someone can't drive anymore and they just need help getting to the doctor and back. And then someone else might be just, lonely or isolated. Maybe the family or friends or family are all up north and that person's down here by themselves. They have no one to really kind of, to be their companion anymore. That would be another option for them is to have someone come in the home and be that companion, that homemaker, that person to help be their friend and give them someone to engage with, someone to look after them. So, and then also another one would be just malnutrition. Just making sure if someone's maybe struggling with when it comes to meals. A lot of times what we've found is people, you go into their home and there might be expired foods, things like that. Maybe they just don't have the ability to cook for themselves anymore, and so they're relying on TV dinners and things like that. It might be helpful to have someone come in and actually help prepare meals for them. Or just even cleaning the house or just general housekeeping, things, chores that might be easy for us, but as we get older, it might be, people might need a little bit more help, and so that might be another reason why someone might need those services.
Does insurance pay for home care services?
So unlike Medicare home health, which we discussed earlier, your typical health care, or your typical healthcare coverages through your insurance companies are not going to provide or pay for home care, but there are some other options. There's some alternatives. So there is long-term care insurance. So does anyone here have a long-term care policy? Okay, so your long-term care policy more than likely will cover home care services. Each one of them is going to be different. They might have a daily rate, they might have an hourly rate they might cover, they might just have a cap per month that they might cover. Every one of them is going to be a little bit different, but as long as the home health agency is a licensed home health agency, then more than likely they'll be able to cover those home care services. So another one would be, there's a program called the Statewide Medicaid Managed Care Program. Anyone familiar with that program, or is anyone on that program? So that's a program that's available if someone were to be on that program, and depending on whether or not the home health agency is contracted with providers under the statewide Medicaid Managed Care Program, depending on that, would depend on whether or not that agency would actually be able to provide those services and bill that Medicaid program. So Medicaid might provide services, also the VA. And typically there's going to be two coverages under the VA. You're going to have the VA aid and attendance, and you'll also have the VA, a VA healthcare plan. So depending on certain VA aid and attendance policies, if you qualify for the housebound status under their policy, aid and attendance might help pay for some home care services. It's basically just a set amount per month. They might go towards the cost of that. And then on the other end of things, you'll have someone that could qualify for a VA healthcare coverage, and if the home care agency has a VA contract, then they would be able to maybe come in the house. Maybe the VA might say, hey, we'll pay for X amount, of hours per week to have someone come in the home, and then depending on that contracted rate, the home care agency could provide those services. What's that?
Do you have any questions?
Do you guys have questions?
Wait. Here you go.
On the VA benefits, does a person, like my mom, my dad was only in the Air Force for 5 years. Is there like a criteria, or is this something we should be looking at now to see if she even has it, or?
I mean, I would definitely go to the local VA office in town, because there's going to be two benefits. One is this aid and attendance, which kind of goes along the same theme of the whole wartime and what you'll find later on in the afternoon on the assisted living side of things. But then there's also like a kind of a healthcare coverage component. So one's like a supplement just to help people out. It's a set amount. It would tie into the wartime periods. That would be called the aid and attendance. I think it's called like housebound aid and attendance, somewhere along those words. But your local VA office should be able to help answer you the questions in regards to that. Yeah.
And you can see me later, and I'll give you the information for the contact.
Yep.
We have a question back here, Grace. Hi.
Okay.
Hi. Takes care of my husband. I'm the only one, and we're down here by ourselves. What happens? Is there insurance, or is there somewhere covering if I should go into the hospital for a few days? What becomes of him?
Gotcha. So now, is there any other oversight? Like, is there anyone else in your family or friends that might be able to?
Let's say no.
Okay. So yeah, I mean that's definitely where this what we're doing today and pre-planning, having options. You know, even like for instance, like even if you just had someone come in your home, just like maybe for 2 hours a week or something like that, just to establish the relationship. So that way, if something like that did happen, you could easily call a company because you've already developed a relationship with them. There's already a familiarity there, and you could just call, hey, I need 24-hour care for 3 days or something like that. So that's why this being proactive and you guys coming out today. I mean, you guys are the most proactive people in Charlotte County, and so being proactive in that way to establish those relationships earlier on are gonna prevent you guys from having to have a crisis moment like that.
Yeah, it can happen.
Yeah, but there isn't any like insurance necessarily that's gonna be able to pick up the tab on that. So, in an instance like that,
Okay, thank you.
Yep.
Pertaining to that question that she just asked, like if you don't know anybody here, like she just said in there, can we come here and you will tell us where to go to get this help?
Yeah. So exactly. That's so Amy's job. That's one of her responsibilities out of many others. but that's what the service is here is essentially the Seniors Blue Book is a great directory for all these services that we're talking about today. But then our goal is to help you guys, and that's why we're putting on an event like this as well. But is to also help you guys figure out where to go in a situation like that. So if something like that comes up, we want to be your contact so we can at least help you get to the right person, find the right resources in town, and use the basically we could say Amy could say, hey, here's the go to Walgreens, pick up this directory, and then look in this section on the Seniors Blue Book and call these 3 companies. They can help you out or something like that. So that is our goal is to be a point of contact for you guys, because we've always done this before. I mean, we've always been a point of contact for people, but it's typically after they've needed our services for Chelsea Place. And so what we're trying to do with this information is help prepare people in advance so that they can, if there is a crisis situation, they're already familiar with what they need to do, who they should reach out to, or if they don't know, they can reach out to us and we can point them in the right direction. So.
I'm coming. He's coming.
Pam.
I'm following in the 2 previous questions. Is Chelsea Place will go and assess people in their home and see if they need the service of the Chelsea Place provide. Can I refer them to you and they can call, or I can. Sometime I think I have to call for them because they, but they will be okay.
Absolutely. I mean, just if you were to call, just have them ask for Amy, and Amy could always be a first point of contact in that situation to go visit with them. So if they know exactly what they need, then they could reach out to maybe assisted living or home care, daycare.
Well, they live by themselves.
Right, but if they have no idea, or if they live on their own and they can't get out, then we can absolutely go and visit with them and just we basically kind of go over their situation, figure out what's best for them, what they need, and then advise them in that way. So
but they will do.
Absolutely, yeah. All right, so I think we're gonna bring up Miss Pam. Thank you, Miss Jamie. I get to interview someone now. All right, so Pam, we gotta switch this thing here. Wait, I turn it on. Hold on. All right, boom. There we go. So Pam is she's the owner of Grand Care Plus, and Grand Care Plus is another home care agency. We like to partner with people that we feel we can trust and we feel are trustworthy. And so I know when we first started, she was someone that we could rely on. She was someone that even before we even had home care, she was a person that we felt comfortable with. So today it was important for us to bring someone for you guys that we felt like was another trustworthy home care agency, because there's a lot of home care agencies out there, and we're all going through some of the similar struggles, but at the end of the day, it's like where's the leadership? Who's helping oversee the direction of the agency and stuff like that. And we feel like Pam is a great partner for us too. So so that being said, wanted to ask Pam some questions here. So welcome, Pam. Is your mic on?
Good morning.
No.
Good morning. I really don't need this. I have a big mouth.
I know it's the.
Hello.
All right, there we go. All right, so Miss Pam, I guess do home care agencies do they charge a minimum dollar amount, or do they charge like a flat fee? How does that work as far as what's the least amount of services I can start out with?
The least amount of services would be probably the 1 hour shower visits, maybe the transportation. But for a lot of companies, my company offers 3 hour minimum. I think your company offers a 1 hour minimum. Everybody offers different hours minimums and different rates. Yeah.
So, and I guess when it comes to the minimum, whether it's a dollar amount or it's a rate, I guess what could someone expect to pay for that service?
It ranges anywhere from, I believe, $18 an hour to up to $26 an hour, to my knowledge.
Okay. And what's interesting too is if you think about like home care, homemaker and companion services versus maybe personal care. So if there's hands-off versus hands-on care, that's going to be probably one of your biggest differentiators when it comes to what the costs are for that. So I guess what qualifications do you require or have you found in the industry? So whether it's yourself or the industry itself, what qualifications do you see that people are required to have for home care?
Qualifications, you have to be able to pass a level 2 background check, and that is where they are fingerprinted and it goes to the state, which is ACA. They're the ones that take care of all of us, make sure we stay in line. And your normal CPR certification, health check, TB tests, stuff like that. I go one little extra step and make sure that there's no other issues to worry about, because the level 2 background check is good for 5 years. A lot can happen in 5 years. And even though the state just requires us to make sure that they have no felony charges, there's also other ways to double check on that. So when you call on your home care, just make sure that they're doing their homework and you're doing your homework.
I guess when it comes to someone that might be suffering from Alzheimer's or dementia, maybe Parkinson's disease, is that person, or are you able to care for them? With if they're suffering from some of those things, is that something?
Course.
Okay. So is there training that's involved when it comes to maybe Alzheimer's or dementia training, or?
We have an RN, and as I think everybody else has an RN who makes sure that they are trained. We take in-service testing. Everybody has to go through certain tests, Alzheimer's, dementia. There's several other different ones, but those are the important ones we feel. And training for personal care, and even companion care. Even most companions have been taking care of people their whole life. I mean, they have, and most of them have been females. It is what it is. But
I know we only got 2 guys on our team. It's me and Gene.
Yeah.
That's it.
Yeah. So yeah, for sure.
So I guess when it comes to choosing the right home care agency or like getting started, like what is this process like for those that like they were saying in the audience earlier, if they had that immediate need or that crisis moment, like what's the process? Like what would they be walking through? What should they expect when they first make that call before they could actually start services?
Well, the young lady that I was talking about, if she went into the hospital,
right.
Most hospitals and most doctors' offices, a lot of them have all of our information and they work with all of us. For me, they just give us a call and we would come out and do an assessment and do our best to help you with the needs you need. But what Chris is doing and what all of the other companies here are doing is really, really important and very helpful for all of you. So hopefully You'll take the information and the brochures and call us if you need us.
So if you know, say like that happened and the doctor referred to you, like what's the turnaround time between, like if I called you this morning at 8 a.m., you know, what's the typical, I guess, you know, timeline to actually receive care?
Normally, for us, we can provide service the same day.
Okay.
Normally.
Right.
If not, of course, obviously.
And there's a caregiver shortage nationwide, so we're all struggling with this battle of trying to find the right people or enough people to meet the needs that are there. So.
Right, and that's why we all partner up. I partner up with Helping Hands. I partnered up with you. I partnered up with Right at Home. We all work really well together and partnered up to try to get that service, because that's the most important, is being able to provide the care, especially if the young lady is going in the hospital. She's got enough to worry about. She doesn't want to worry about, you know, who's going to take care of her husband. But the average turnaround time, I would have to say, would be 24 hours.
Gotcha. And then is there any paperwork required by the doctor, you know, to actually start services, or so are you able to start services without that?
No, the only thing we need is a consent form. A consent form. After the assessment's done, that's pretty much all we need.
Gotcha. So I guess then, any questions that you guys have might have for Pam?
Kind of hard to know.
Microphone, please.
I think we had two. Yeah. We're coming, guys. We're getting our workout this morning. Thanks, Sam.
In the case of the young lady, we were talking about who signs the consent form. Does she sign the consent form to come in and take care of her husband for you to come in? Or does the doctor sign the consent
No,
form?
it would be her.
Her.
Yeah,
Okay,
she would
thank you.
sign. Yeah.
So typically like a responsible party then?
Yeah, the responsible party, like if somebody's got Alzheimer's, so and we go out and I think there's a question in that judgment, we would reach out to possibly a power of attorney or whoever hopefully would be there. But I have had a couple calls where I wasn't really sure that they knew what they were doing, or that maybe there was questions.
Right. So then it's I was trying to figure out like who is the responsible party.
Exactly.
You know?
Exactly. And normally you can also, if you can get out of that person who's your doctor,
Right,
who's your
exactly.
GP, that's
Right.
always the best way to go. I believe she had a question.
I get a lot of questions.
This is probably maybe not answerable, but what if the caretaking, like say the wife, goes off in an ambulance, but the husband is at home and is still in need of someone? Is there any type of care that's like super immediate? Like
We all do our best to make that happen. I have actually provided somebody within 30 minutes, and it was crazy because it was me. but if they are taken off in an ambulance, they're going to know. I think the ambulance people, obviously, I think the EMTs are going to know if there's an issue, or they might, because they're really good about that. So they might question, and they might end up bringing him with.
Okay.
And so it would just be, I guess it would just depend on the emergency.
And I know, you know, Charlotte County, because, you know, we are I think we were number one. I think we're number two last I checked, as far as the highest percentage of elderly in any county in the whole nation. Sumter County actually just passed Charlotte County recently, which is the Villages, but you know, they're growing. I don't know if you've ever been up there. That place is crazy. That's like 90% elderly, and that, you know, senior 65 plus up there. It's insane. But they're having a party up there, man. They're having fun.
Can I butt in?
Yeah.
Is that all right? So, what I would highly suggest is registering your loved one with an agency before you need them in an emergency, because there's no obligation, correct?
Exactly.
And with most agencies, just to play it safe if it's something like that happens.
And that's like, that way you have that established connection. So it's like whether you use them, you know, a little bit, or you just at least, you know, have become familiar. You've gone, reached out to them, had that initial consult, went to the home. You know, the information's in our computer system. You know, you're ready. That way, if there is that you know, emergency, you know, you guys have a go-to person. You know. Cool. Any other questions? Yes.
Oh, yeah. Is everyone that works for you or with you licensed and insured?
Yes, ma'am. For me, we're a home health agency, so they're all my employees. All of my employees have to go through, obviously, the level 2 background check. They have their training, CPR certification, and they're under my liability, my bond. I pay their payroll, so they're under my payroll.
And I know, Pam and I were just talking about this the other day, because what's interesting is in our industry, so, there's a general liability policy for a home health agency to carry on behalf of, just the company and, being home, the people. There's a workers' compensation that covers their employees as well. And then there's a third one, which I didn't even know, this is one of those things that I didn't even know about until I did more discovery. But when we opened our agency, I asked the gentleman like 3 times, I said, I just want to make sure this covers transportation, for like a caregiver to take someone to a doctor's appointment. And he's like, I think it does. Let me check. But he wasn't really sure. He goes to look into it, and what we find out is there's another policy. It's called non-hired, non-owned auto coverage, and that would then actually cover someone if they drove your loved one's vehicle, or the person they're caring for, the client's vehicle, or the caregiver's vehicle, and they were transporting someone to and from a doctor's appointment. If they have that coverage, then they're covered by the insurance company. So just making sure that those coverages are in place, so.
When your agencies hire different people, how many levels of background checks are there and what's the difference?
For us, there's the level 2. The state requires us to make sure they can pass a level 2 background check. And like I said before, it's the fingerprint, it goes to the state. And let's say they get arrested and it's a felony. We immediately get an email from the state stating this person is no longer eligible to be a caregiver. But for me, my background was in legal. It wasn't in medical. So for me, I go that extra step. Every 90 days, all of my staff is checked again. I go to the Charlotte County Clerk's Office, Lee County, and Sarasota, because that's where my license covers. So what I do is I make sure that the girls go through, put their names in, and just make sure there's no DUIs or misdemeanors or domestic violence or drug use of any sort. So every 90 days is what we do, because a lot can happen in 5 years, much less, 1 week, much less 5 years. So that's what we do. So, and that's the difference. But it's only the one level 2 background check that I'm aware of that we have to do.
Is there a level 1 background
Yeah.
check?
So I was gonna say, so what the biggest difference is with the level 2 versus level 1, and everyone in healthcare, like, so whether you, like anyone that works here in our daycare center, at our assisted living facility, in home care, pretty much anyone in healthcare, hospitals, skilled nursing, they're all gonna have a level 2 background check. The level 2 basically is a national database versus like the level 1, which might be a state database. So that's the biggest difference between the level 1 and the level 2. So.
Level 2 is the highest level you can have. Like, there's a level
Well, no, I think there's like, my father-in-law, he works for Lockheed, and there's all sorts of levels as far as background checks are concerned. But as far as like in the healthcare field, the level 2 is just it covers a national database. So when they do the screening, they're not just checking Florida's records, they're checking them.
to go pick up the food.
Hey, that's important. That's an important alarm.
Also, I want to add, which I wasn't really completely sure of this, but I had a caregiver who had just moved here, and they got a ticket. It was in Georgia, very small county in Georgia, and I got an email from the state saying that there was a bench warrant out for her arrest, and this was before I knew it was about a ticket, and I was from Georgia, so I was kind of impressed. So I called the caregiver and I said, I just got a notification that there's a bench warrant out for your arrest. And of course she's panicking, freaking out. And I said, did you get a ticket? And she goes, I got a ticket? And then she's like, I forgot to pay that ticket. I said, well, honey, they're gonna arrest you and put you in jail. It was like a $70 ticket that she just forgot about because everything with the move and everything. So it was Georgia, it was the state of Georgia, and they notified us. So I was impressed.
Yes, so that's that extra, that level 2, definitely helps out with that national database. So, well, thank you, Ms. Pam. Appreciate it.
Well, thank you.
Thanks for coming out. if you guys have any questions, her contact info will be in the back, and of course she'll be here for a little bit too to answer the questions that you guys might have. Okay. Run the show, girl.
Okay. So there's also another option too, which somebody just reminded me about. But Charlotte County Sheriff's Office offers a lot of different programs, and one is the Red Dot program, and you can contact them. I have their community outreach person's phone number, and it's a dot that you leave outside your front door, or sometimes it can go also on your refrigerator. They have a list of basically if there's anybody in the house, if they have any medical needs. So if there is an emergency and somebody goes to the hospital and you have a loved one in the house who needs some special attention, it'll be registered with the Sheriff's Office. So that would go through 911. But I can let you know later. And by the way, my name is Amy Conti, and I'm the Senior Resource Specialist for Chelsea Police. Thank you.
All right, guys, so we're gonna roll into, we got 3 more speakers coming up. Debbie and I want to choose, so Debbie, who knows Debbie? I know a lot of you guys know Debbie here. All right. So Debbie is our executive director here at our senior daycare center. So, you know, she's been with us though since, man, how long has it been? I mean, back actually since Chelsea and I got married.
Yeah.
2012.
8 years.
8, is it? No. Yeah, have I been married that long? 8 years? I don't know. Oh shoot, this is live. Oh no. Oh no. Wow, I can't believe it's been that long. So I guess it's been 7. It's been 7 because it's 2012, 2019, right? So 7 years.
June's right around the corner.
I know, that's true. All right, yeah, that's right. All right, so Debbie's been with us ever since then. She's been, basically at that time we had the assisted living facility. We recently opened our senior daycare center, and this has been something that for us is just an absolute passion project for what it does for people. And so we want to talk a little bit because what we've realized is that the industry itself is kind of like this underground world. I went to the national conference, and the national conference was like a local state conference. It was just so it's such a smaller industry that's just starting to kind of gain some traction as to what is this about, how does it work, what types of services are offered and things like that. So that being said, we want to share a little bit with you guys about what adult daycare is and what services they offer, and just some information to help you guys understand what these types of services are. So are you interviewing me?
I'm interviewing you.
Oh,
so let's go ahead and start with that. What is adult daycare center?
So an adult daycare center is basically a daytime program. So it's going to be something that's open typically from 8 to 5, maybe Monday through Friday, maybe open on a Saturday. And they're going to provide activities. They're going to provide safety, supervision, general oversight and well-being for people. But it's used for 2 reasons. One is it's going to be a great outlet for socialization and for engagement with folks that might not have that anymore. And it might not be a part of their life. Maybe some of the folks that they used to be friends with or the connections they used to have, maybe they no longer have those. They've moved away. Other things may have come up, and they're kind of isolated at home. And so daycare is going to be a great way to kind of re-engage from a social standpoint, to be a part of a community setting, but it's just during the day. It's not overnight. It's just during the daytime. So the idea is we provide, or an adult daycare center can provide all the same services you're going to find that maybe home care can provide. Assistance with activities of daily living. So that might be help with any incontinence care or memory care issues. But at the same time, it's also a stimulating program to help provide that socialization, to reduce isolation, and to help kind of help someone become part of or belong to a community again, as opposed to being on their own.
So who is the ideal person that needs adult daycare services?
So yeah, I guess
so first, let me give a big shout out to my members here. I have about 6 of my members here that attend our adult day center here today. and their families. And I just want to thank you guys for coming out and using the adult day services. And maybe you guys can also help with anybody that has any questions today and let them know how this has benefited your loved one.
Because I think it's important too. Because I see Bryce here, so I mean he's like right in my line of direction, you know. So I love Bryce though, because he always makes me smile. He makes me feel good, you know.
Yeah. So we have Bryce here. We have Bob here. Clarence is here. Grover's here. Emo.
Grover,
my favorite guy back there.
Grover, you got to say grace today too for lunch.
Yeah. I'm putting you on the spot there, Grover. And then we have Lou back there in the back. Yeah. Thanks, guys, for coming out.
So I was gonna, you know, I want to share something with you guys real quick. Hold on a second. So it was interesting when doing research about the socialization issue, because care is important, and so it's like, you know, at the end of the day, we can cover the care part. We got that covered. You know, if there are those things that, you know, in regards to safety and stuff like that, we're available for people that need that. But at the same time too, the socialization part of it's so huge. So I wanted to, I got 5 like true and false and I guess multiple choice answers here. So I was gonna ask you, Debbie. So
Put me on the spot.
I know, right? You didn't even know I was doing this. So true or false? Social isolation with or without loneliness can have a large of an effect on mortality risk as smoking, obesity, and high blood pressure.
True.
True. Let's ask the audience this next one.
Yeah.
All right, so audience, we got it's a blank percent, increased risk of mortality over time from social isolation and loneliness. 11%, 29%, or 35%. And that's for the percentage of increased risk of mortality over time from social isolation and loneliness.
35.
Well, it's 29. I was trying to trick you guys.
You tricked us.
I know, that's right. Well, it's funny, I was doing a test run with Amy last night, and she guessed the highest number, so I was like, all right, I'll make it the middle one, you know? All right, so true or false, 70% reduction in cognitive decline by those who are frequently socially active. 70% reduction in cognitive decline by those who are frequently socially active. It's this would be reduction in so 70% reduction in cognitive decline by those who are frequently who are actively engaged socially.
True.
That is true. Yeah, I mean when we did this research, because we did a presentation in January, home care versus daycare, and it was just to kind of share some different things, and one of the topics that I researched was the isolation and reduced isolation and loneliness, and it was incredible just to see the statistics, and these aren't just numbers I just pulled off Google. These are like research studies done by professional colleges and institutions that have taken the time over like a 20-year period to actually do the research on socialization. So it's crazy when you see these statistics. So I got another multiple choice one. It's what percent reduced risk of developing dementia if socially engaged? 25%, 32%, or 40%? Reduced risk of developing dementia if socially engaged? 40%? See, I didn't trick you that time.
Good one, thank you.
One more. Let's see here. It's all right. Waterproof floors. All right. So last question. This one is so important, and honestly, I was thinking about that story the other day I heard, which I'll share after I share this stat. But this is another true or false question. The elderly will have a 50% more food intake when eating among people in a social setting versus those who are isolated.
True.
And it's crazy. We had a member, and just I was talking to a family, and this particular person was up north, and they were living in a socially isolated situation. They were living on their own, and so one of the biggest concerns they were having is she was no longer eating. She was like, you know, just really kind of minimal, like a bite or two, and just really just a minimal amount of food intake, you know. And it's just because like the loneliness, home alone, no one to talk to, just, you know, no food in the house, things like that. And so it was interesting, even when the daughter would come over and prepare a meal, same thing. It's just like there was not enough engagement for her to actually want to eat a proper meal. And it was interesting. So when she had started attending the daycare program, it was a complete change. She was amazed because all of a sudden she went from just taking bites to literally like eating the entire I'm thinking, you know what I'm talking about right now.
Including pie.
Yeah. Well, everyone eats dessert, man. There was no leftovers when it comes to dessert, you know. But it was interesting that like, because I think she even pointed out like where in the past she might have like a bite or two of pizza, and now she'll eat 2 slices of pizza, and it was just to see that big of a difference because it's like, you know, and then they're sitting on the table and they're all competing for like who can get the next Gatorade refill, and you know, and it's
When
like
somebody asks for a second, say, "I'll ask for a second."
right, exactly, that preferential treatment. So it's interesting when you think about how important it is that when you're, if you think about your loved one maybe at home alone, just, you know, being able to get them in a setting where there's a group of people at the table together and they can share a meal with each other, it helps kind of engage them in that process of actually eating that meal, entirely as opposed to just, nibbling on it, so.
Absolutely. So, does insurance cover adult daycares?
All right, I'm not prepared. Let's see. What do I got? Okay, so when it comes to insurance, so we're very similar to home care. Long-term care insurance, in most cases, will cover adult daycare services. So depending on your insurance policy, it might be written differently. And then also, too, just so you know that every state is different as far as the way they license an adult daycare center. So some states are not licensed. Other states, you'll find, maybe have more or less restrictive licensing. And so just, depends on the way your policy is written, because a lot of these policies were written a long time ago. And so these policies were written, at a period of time where a lot of these services that are available today maybe weren't as robust or as, there wasn't as much of an industry for them yet. So just, make sure that, you review that or go over it with your insurance agent if you still have that person. Or maybe call the company up and just make sure you can talk to someone and ask them, hey, what services does this include? And if you can't tell based on that and they didn't give you the answer you're looking for, maybe ask them more specifically as opposed to what you're looking into, if it provides services, say for like an adult daycare center. There might be a different terminology that they used back then, daycare program, an adult daycare center. There might just be different terminologies that they use for these types of services. So, was there more to that question? Was it just insurance? And then a statewide Medicaid managed care, that's another program that's gonna pay for these services. And so what would happen is, I think we have like 3 or 4 people that are signed up on that program.
We do. We actually are contracted with 2. We're contracted with Sunshine and Humana.
Okay, so Sunshine and Humana, what it is so Medicaid, what they did is they would basically allotted money to private healthcare, so Humana, Sunshine, these private healthcare coverages, and then those companies are responsible for divvying up the money to their the people that are actually clients of theirs to services like adult daycare or home care or things like that. So they become kind of a middleman for us to medicate. So we actually will sign up with that provider. So if your loved one is on a statewide Medicaid managed care, it's a SMMC. If they have coverage through one of those programs, then we might be able to provide services for them. The only thing is it would depend on whether or not that insurance company, if we're contracted with them. But if we're not, typically what will happen is we'll work with the insurance company to expedite the contracting portion of the agreement. If you guys find that the service is needed or valuable for you, and you're already on that program.
And a lot of times they can give us a single case agreement to get you started while we get in the process of being contracted with that particular
Exactly.
area.
So we might not have a full contract in place yet, but they might say, okay, hey, for this individual, we'll go ahead and issue a contract, or we'll issue a single case agreement, which will basically just be establishing like days, amount of hours, and stuff like that. So.
And they also will provide transportation as well.
Yeah. So typically that transportation might not be contracted through us. It might be contracted through like an Ameritrans or an Ambitrans,
A third party.
or a third party, but typically they'll provide that transportation service as well. And then so we got so long-term care, statewide Medicaid managed care programs.
VA.
Yeah, VA, so aid and attendance as well. And then there's a VA healthcare contract that we're, it's the longest contracting process in the history
It's
of.
in the works. Yeah.
It's been in the works for the last 7-8 months, but
Yeah.
It's one of those things that's so very similar to home care as far as the how it's covered. And then as far as cost is concerned, for private pay, you're going to find every place is going to be a little bit different. So what we found is there's some places that might charge an hourly rate. There's some places that might charge a half day or a full day rate. There might be some places that are like a 2, 4, 6, 8 hour day. So every place is going to be a little bit different, because keep in mind, when it comes to adult daycare and you look across the country, most of them are mom and pop organizations. So they're like us, smaller organizations that have come up with whatever programs that they have. So they're all going to be a little bit different. There's not like a standardized program that exists. We charge an hourly rate. We're just now transitioning to no minimums, and I think we just so what it is every 15-minute increments is how we bill. So starting what?
Starting now.
Yeah.
Starting as of May 1st. There'll be no more minimums. So you can bring your loved one in here for just an hour if you want. So you can go to the store. You can just drop them off for lunch. So that way we can provide them a hot meal. That also includes, everything is included in that as well. Once you become a member, there's also bigger savings to that as well. You can also use the home care and the adult daycare services together. A lot of people do that. Like we may send home care in the morning to get them showered and ready and transport them here in the center. And all day they could be in the center socializing with other folks before you take them back home.
And we always encourage that too, because of the importance of the socialization. I can't speak. Because of the importance of that, though, it's important that if we can get some socialization to happen, and then also maybe help you guys out, because you guys might be caring for your loved one at home. It might be important for you guys to have that in-home care. So a lot of times, using both home care and daycare in conjunction with one another is very helpful. Because you might be able to get those services that are needed in the home taken care of. They also get a little socialization. You might get some time away to do your errands,
and you're saving money.
Yeah, and that's the other thing too is when I don't know if did I say the cost? It's $13 an hour. You're gonna find anywhere between like 11 to maybe $13 an hour, or maybe other places that they charge a half day might be $40 or $50, or up to $80 or $90 for a full day, depending on again the type of daycare program. But so it is going to be about half the typically daycare will be about half the cost of in-home care, where home care might be closer to that $20 to $25 range or somewhere around there. So if you can use both services. To get the best experience for you and your loved ones, save a little money. They get socialization. You guys get the time that you need to do what it is around the house that you guys need to do. It's a great combination to use both services.
It is. It's a great respite for the families. I've seen numerous families come in here, and they are so worn out when they walk through this door. And after about 3 weeks of their loved one being here in our care, they come back and they are rested. Then we have lots of testimonies, even in this room, that can tell us how rested they are. Just to have that couple hours alone, So it's a great way to utilize respite care.
Yes.
We have a question in the back.
I was thinking, and we'll roll into questions because then we got 2 more speakers up before lunch. So.
It's not really a question. I just wanted to say that my name is Joanne, and I'm here with my father-in-law who has severe Alzheimer's, and this is my 3rd go-round with a member of my family where I've had to be full care person. And this place is amazing. I love these guys. They're so good with my father-in-law, and they make him feel good. And I'm from Connecticut, and I did have a place up there that every once in a while I would take him to when I had to do errands and stuff like that. And they were okay. They were not that great. They didn't hurt him. Let's put it that way. I just wanted to say that I think Amy, Debbie, Linda, all the people that run this place, Chris, are just wonderful. And they're so good with the people, and they really are loving and caring, and thank you.
That's why we do this, though, guys. Because you know, I mean, to make a difference in people's lives, whether it's this event, the people here speaking today, you know, it's this is a tough time, and you know, if we can make a difference in your guys' life and help you guys figure out what to do next, like that's what it's all about.
So how do you guys get started with these services? Just come and see me. I'll answer all your questions. We have the rest of this afternoon. Maybe come and see me at lunch, as well as our lunch break happens as well.
Do any of you guys have any other questions that we can, you know, get from you guys now before we wrap up this section?
Whoops. The Chelsea Place will pick up their patients or their residents from the house.
Yeah, so we provide transportation. So it's basically just we just charge a one-way fee, so people can use it round trip or one way, however they want to use it.
My husband, well, he's diagnosed with Alzheimer's for the past 6 years, but lately, 4 months ago, he doesn't want to leave the house. I mean, I have to kind of force him, which I don't like it because he gets, but I mean, he will go any place with me, Walmart, any place, the Sunset every day. But 4 months ago, he doesn't want to leave home. And I know he needs there because he's an outgoing person, and you know, I would like to know if. But when somebody is with me, let's say my daughter or my grandson or whatever, or friends say, okay, let's go, Orlando. We were invited to dinner. Let's go. And then he gets ready and go.
Right.
So with me, no, I'm sleepy. No, I'm tired. No, I don't want to go. No, that's crazy.
So I would recommend you tell him you're going to bring him out for lunch.
Oh, I try every, even for dance because he loves dance.
We have live music every day, and a lot of these centers do.
Dance, let's go. And,
Yeah.
No, it's with me, so I know that it's. I was thinking, you know, 2 days or 3 days a week that somebody can help me, even if they get into the car.
Yeah.
Sometimes he gets into the car when we go to places and he doesn't want to leave the car. But if it's somebody else.
And what's happened is our team has become good salespeople, and like when they get to the home in the vehicle, you know, they start, you know, like a lot of it will be trying to help get that person, you know, so if someone's resistant to maybe like going, you know, for a ride, or you know, maybe the first time they're getting used to transportation, you know, they're not used to that process. You know, the girls really will help, you know, that person feel comfortable, you know, going with them and coming here. So, and a lot of times, you know, they end up finding ways to just make them laugh or smile or convince them, or, you know, so.
Different people, because that's what
Right.
happened.
Exactly, because it's always harder on the families. You guys, we always get the best version of your loved ones.
Yes, we do. But then we send them back to you smiling,
Right.
so it's a win-win. You get them here, they'll go home smiling, I promise. Isn't that right, Bill?
And that's why we always refer to this place as it's like medication. You know, you gotta take it every day, though. You know?
Yeah.
So.
I'm going to join the testimonial with this woman from Connecticut because my husband attended the daycare center for about 1.5 years, and it got to a point where he never even kissed me goodbye. He just would walk in the door, they would grab his hand, Harold, you know, and it just went on all day long, all day long. He benefited quite a bit from it, and it's just a great group.
Thank you.
I got a question though.
Thank you.
If 30 years ago I was in Chicago and got a long-term care policy, and then I moved to Florida, there's no problem crossing state lines with something like that, is there?
There shouldn't be at all. No.
Okay.
So it's definitely like the long-term care policy industry is like just getting started, because here's what happened. They wrote 7 million policies that have been written, and there's only 270,000 that are active right now. So it's an industry, it's a meaning like just all the infrastructure when it comes to how do we process claims, how do we handle like this wave of folks that are going to start actually using and activating these policies. There's going to be this massive like influx of long-term care insurance that hasn't taken place yet. So so yeah, I mean that it wouldn't matter which state it was purchased in. It really is going to come more down to each state's so different. The hardest part is if you go to a state where one of those services in that policy that's covered, if that service is not covered by or if it's not licensed, if it's not a license, like if that state doesn't require a license, like some states don't require assisted living facilities to have licenses, or even places like this, they can be an unlicensed state. So if it's unlicensed, that's where the insurance companies might have difficulty trying to figure out, well, how do we qualify this company as a licensed provider. So anyways, we'll all be here for questions. I know there's a lot more, but 2 more people, and just so you guys know, the goal for this morning session is we're covering all the ways that we can help you guys keep you and your loved one at home. And then the afternoon will be, what happens if we decide that, we need to move into senior housing and move out of the house. So again, everything that we're covering this morning is trying to help you guys stay at home. So, but we're gonna bring up, let's see here, we're bringing up, I think is Nafi from Tidewell Hospice is coming up next.
Thank you guys for coming out. I appreciate you.
All right. How are you?
Oh, I'm great. How are you?
Doing good. Doing good.
Good morning, everybody. Good morning. What a fantastic event. Thank you for having me here.
Oh, thank you. Am I pronouncing it correctly? Nafi?
No, you're right.
Okay. I just want to make sure. Because so Nafi's from Tidewell Hospice, and so Nafi, I have a couple questions for you. And of course, feel free to just butt in and tell, because you know more about what you do than I do. But I know from my end, what I've seen when it comes to just, families when they're going through this process and what they need. First of all, I think, we've always known hospice to be, or like maybe my impression of it is different than what I actually learned it actually does. So my impression was always kind of like, end of life, terminal, maybe someone suffering. But I guess what I'm trying to say is, I feel like there's a lot more to it than just that. So can you just maybe elaborate a little bit more as to what you guys do, what services you provide, and maybe some things that we may not even be aware that you guys do?
Well, thank you for having me, first of all. This is a great platform, and you guys are doing a wonderful job. So thank you, Chelsea Place and Seniors Blue Book, for putting together such a great event. My main job is to get out in the community and educate people about the services that we provide. So this is wonderful that you invited me and included us to participate.
I'm glad you're here.
And Tidewell, for the most part, people think of hospice, as end of life, which for the majority of the time it is dealing with people who have advanced illness. And we are here as a support system to help people deal with that part of the journey. Unfortunately, there's a lot of misconceptions out there about hospice, and people are afraid of it. I can't tell you how many times people come towards me, they see my badge, and they're like, ugh, hospice, or they're stuck dead in their tracks. But hospice is more than just dealing with death. I view it as helping people with end-of-life journey, but providing compassion, providing support, relief for the family. The services that are available that people are not aware of are tremendous. One of them is we are currently helping people, the community at large, getting the advanced directives together, answering those what-if questions. I have heard quite a few of those this morning, and we are trying to find ways for you guys to have those conversations, because it is important to have those conversations and know what if this happens, and how do we communicate with our families about these situations, and how do we have a plan if something happens to the caregiver? What does the family do, or how does the patient get treated, and all of that stuff and cared for? So these are the type of things that we do at Tidewell that are free to the community as well. But hospice, most people don't know, is a Medicare benefit. So if you have Medicare, it is covered. And what does that mean is most of our patients, we take care of about 1,100 patients on a daily basis in the 4 county area. So we are in Sarasota, Manatee, Charlotte, and DeSoto counties. And 1,100 patients, and most of those patients are at home, wherever home may be. Whether you're a private residence, or an assisted living facility, a nursing home, hospitals, we come to you. We do have some hospice houses, about 8 of them in the area. There's one in Port Charlotte, and there's one in Inglewood, Venice area, in the vicinity. So we provide care at home. So because you have Medicare, we can deliver hospital beds to your home, bedside commodes, any of your medication that is pertaining to your illness will be covered. So it is an extra support that you get that you're not even aware of, that you don't have to pay for. And you have a great team of people available at your disposal to support you. So the IDG, which is called the Interdisciplinary Group, sorry, consists of your doctors, the nurses. You have CNAs that can come helping with bathing and grooming. We have dietitians at your disposal as well. We have, social workers. Our social workers do actually an amazing job providing resources for you, guidance, helping you with what does the family need. We have child life specialists because unfortunately we do take care of children as well, or younger individuals. So there is a great team that's available to help you, not just the patient, but the family as a whole. We have chaplains that are non-denominationals as well, available with your spiritual guidance. So, and there's just so much that is done beyond just helping you with medication management and symptom management, which is the majority of what we do, but we take care of the family as a whole.
And like, I was thinking about this too, because when we first started our assisted living facility, so this was one of these things that I didn't really realize until I had spent more time going through this process, but it was when we had someone that all of a sudden, it was like we were at a point where this person may no longer be able to stay with us because we're not a skilled provider. We can't do some of these higher level skilled type services. And I remember that was when we learned that hospice could come in and actually help us with some of the things that were going on. And then it would ultimately what was cool about that is it helped the individuals stay with us, so that they didn't have to make another transition to another place, which ultimately can be very stressful on both the individual and their family. And so it was great to be able to work with like hospice, where they could come in and take over some of the services that we weren't able to do, and then they could help that person stay with us. So whether that's in your home and you're like overwhelmed and you're like, I can't do some of these things, and if it qualifies for them to be able to come in, then they can maybe help you guys out so you feel like you don't have to make a rash decision,
Absolutely, especially being that it's Medicare covered and you have that benefit, use it. Why not?
Right.
I mean, once there's been a determination that hospice can help you, don't wait until a week. Right now the average length of stay nationwide is about 7 days. But you have that benefit. If you have a prognosis of 6 months or less, you can use it. So why not use it? So your family's getting support because we can provide respite for your family members while you're in the hospice care. So if you're at home and you're you're the primary caregiver, we can have volunteers come assist you whether you want to go run errands, go get your hair done, meet your girlfriends for lunch, or whatever the case may be, there are volunteers that are available to help with that. So giving you that respite. Not only that, if you're in our services, in a situation where your caregiver needs to go to maybe your grandson's wedding, and they need to be out of town for a week or for 5 days, that is covered for the patient to be able to come into a hospice facility and care for that person. So you can have that break, even if you're not going out of town, but you're just overwhelmed and you just need that break. Because unfortunately, caring for somebody can be very stressful. And we want to be able to give that caregiver the break that they need to recuperate so they can take care of themselves and be in charge of, being okay and taking care of the individual that they need to take care of. So that is another way of having the hospice houses. So we have these hospice houses so that we can give, that's another way for you to have that respite. Or if your family member has acute symptoms that need to be managed a little bit better, then they can come into our service at the hospice house, and once they level off, we take them back home.
And so another thing too is just if someone has a diagnosis of 6 months or less, that doesn't mean that every single person that has that diagnosis ultimately, you know, ends up passing away. I mean, we've seen a lot of people graduate from this program.
Absolutely.
You know, I mean, I guess that's what you guys call it, graduating.
We
right?
call it graduating.
Yeah.
I just met somebody the other day. I was at the Inglewood Hospital, actually, excuse me, at Fawcett, and somebody walked to me and said, "Oh, my mother, who's 94, was in your services for 2 months, and they just are okay right now. They're doing so well. They've graduated." So that does happen. We have had a doctor who came into our service graduate actually twice. And so it is possible for people to come into our service, their level of care, their quality of life does improve, and that's what hospice is all about. It's about improving the quality of life while you're battling with whatever it is that you're battling. And not just for you, the patient, but also we factor in what does the family need as well.
Because I know too with like, you know, like congestive heart failure or some of these other things, like, you know, those could bring up a diagnosis of you know, of 6 months or less, but then that person might get stabilized, managed, and then that's where that kind of graduation thing could happen. So, you know, so it's like there's, you know, situations where in my mind this person's not, you know, they don't look like it, they haven't been diagnosed with something that I would think would be, you know, terminal, but you know, maybe that's just the way the doctor's orders read, or the diagnosis itself reads, and all of a sudden now maybe they get under hospice care, we help that person stabilize, and then that person can go on living their life, and they could live for another 5, 10, 15, 20 years.
It's very possible.
Right.
I have had personal experience in that. My mother's younger brother, we were called, it was close to Thanksgiving, I'll never forget that, not this here, but it was in Georgia, and they gave him 2 weeks. They told us, go ahead and make arrangements. He's gonna probably go in 2 weeks. Well, luckily, 2 weeks came and went, a month came and went. He started to get better. His organs were failing when they told us this. But he got such great care, he started to feel better. He lived 5 years past that time. Wow. This is a personal experience of mine. So I know that the work that hospice does is just amazing. That's one of the reasons why I do what I do. I work for this organization, because these individuals truly care for what they do, and they do it with such compassion. I don't know, I personally cannot work with these patients on a daily basis because I'll be crying all the time. But they just do such amazing work, and people can really improve their quality of life, and it's just a wonderful thing that you can provide for yourself as a caregiver and for your loved ones, because if you're having to battle something, why suffer while you're dealing with that? Enjoy those last months or years that you have with those individuals.
So you shouldn't be afraid of her then, you know?
No, absolutely. I think people definitely hope or think that when you call hospice, you're giving up hope, but you're really not. What you're allowing yourself is having a better quality of life for you and your loved ones, because it's facing the reality of what's going on and saying, okay, what can I do to make these next few months much better? Otherwise, the number one comment that we get mostly is people say, I wish I had known. I wish I had known.
And I didn't mean to cut you off. I wanted to share kind of a testimony to them as well. Just another example of you know, just because I feel like the more that you know, because I think you know, for me, and maybe you guys feel the same way, but when I think of in the past, when I ever thought of hospice or I thought of like funeral arrangements, I'm like, I just don't want to talk about those two things, you know. So like I just want to avoid that conversation. You know. But so I think it's important though, if you at least are aware of how they can help, you know, someone go on. And we had a lady that, you know, literally a month ago was living 100% on her own up north, and just like crisis situation, goes in the hospital, chaos has happened, family flies up north, like, you know, just she's like just stressed out, freaking out. brings her mom, down here. Just, I mean, literally, like, this lady's moved to 10 different places in like a month. And so she comes down here, and all of a sudden, in this crisis moment, she's like, she ended up, getting in contact with hospice. Her mom was able to go into a hospice house for a few days while she could just take a breather and then figure out what's my next step. What do we do now? And and this particular lady, ends up moving into our assisted living facility, and she's she's independent. I mean, super outgoing, got a ton of personality. Like, again, just a month ago she was living on her own. So it's not like her diagnosis might have this timeline to it, but it may not. It doesn't have to be. That doesn't have to be the case. It doesn't have to be terminal. It doesn't have to be someone gave up hope, because this is what renewed the family's ability to say, okay, there is hope. I got a little respite. I found time to go find the right resources, and I have hope. And now everyone's doing better.
And if you are in our services for 6 months and you're doing good, we don't kick you out after 6 months. We just get you recertified. So as long as there's a need for us to keep coming to your home, taking care of you, providing you medications and all of that stuff, we will do that. And coming into our services is very easy. Either
the battery might be dying.
Yeah, your doctors can write the order, or if you know that my loved one might be able to benefit. My loved one might be able to benefit from hospice. You can make that call to our access center yourself. So you don't have to wait for the doctor to make that call. You can call and we'll send out a nurse who will come do the evaluation, and things can start moving within 24 hours to get you admitted. So that is definitely something to keep in mind. It's not that you need it today, but when the time comes, or if the time comes, that you know that hospice is here to help you. If I can just share one thing quickly. Our social workers do absolutely amazing job. And there's something that we call the Wishes Fund, where we make sure that we try to grant something to the loved ones to make that journey a little more memorable. So we have flown people down here who haven't seen each other for a long time. We have sent a family on vacation. We had a 38-year-old mother who had 3 kids and hadn't been on vacation. She was dying, hadn't been on vacation for a long time, but she went one last vacation with her family. And we sent them to the east coast of the state, provided their hotel transportation with the family, and she passed away 2 weeks later. But those kids will never forget having that moment with their mom, those last parts of her life. So there are some great stories that we do that we just want to make sure that this family is taken care of, and that those last months, days, or whatever time that you have are going to be memorable, and that they'll take care of the whole family. Any questions?
Yes, I was going to say, if you guys
I'll
have
be
any...
here during lunch, so come see me if you have any questions I can answer.
We're back here.
Once hospice takes over, that the doctors and the organizations that the person has been using ceases. Is that correct?
Not necessarily. Some doctors are involved because our doctors do have a plan of care for you, but they do communicate with your doctors as well.
Okay.
So it just depends on some doctors are hands-on and some doctors are hands-off.
Okay, and I want to add another compliment to Chelsea. My husband
would never dance with me. We've been married 61 years. But he comes to Chelsea Place and he dances and he loves it.
That's just beautiful, and thank you for sharing that. This is why they do the work that you guys do, and I know he's getting emotional here, but thank you for doing what you do. This is why you do
That's
it.
why we do it, Thank you, guys. Thank you. And we love Grover, man. He's I love it when he says grace. When he says grace, he's got to say grace for us today on the speaker too.
He does all the time. Anywhere he goes.
What's that? And we got one more. We got Lisa up next, and then we'll roll into lunch. So I know it's been a long morning, guys, but a lot of good information. So thank you, Nafi, and really appreciate your time. And I think on this one we got Miss Amanda from Seniors Blue Book. She's going to interview Miss Lisa. And Lisa's got a great program. They do a lot of different things. Let me see if I can get the right thing. All right, there we go. All right, guys, get out of the chair. Take a break.
You can do it, Chris.
All right.
Oh, I'll take it. How's everybody doing? Fantastic. Are you getting hungry? Yes. Okay. Well, lunch is here, and we are excited to serve it to you in a moment. But I wanted to ask you, how many in the room have heard of the PACE program? Okay, this is going to be a really great experience for you, because even if it's not a program that specifically benefits you, I guarantee you there is someone that you know that could benefit from this knowledge. And that's the biggest part of what Seniors Blue Book likes to do. Our tagline is knowledge is power. To prepare yourself for the resources that not only you might need in the future, but someone that you care about. So Lisa, tell us, what is Hope PACE?
So PACE, oh, see, I hate microphones. PACE stands for Program of All-Inclusive Care for the Elderly. It is actually a national program that has been around since the late 70s. And the goal of PACE programs is to work with our at-risk 55 and over folks that could end up in either an assisted living or a nursing home. So if somebody can live safely in their home and we bring them into a PACE program, then we're going to do everything in our power to help you to continue to age in your home. So the company that I represent, Hope Healthcare Services, we've been around since the 70s. We're actually celebrating our 40th year, so we're very proud of that. But we actually provide Hope PACE in 3 counties. We're in Collier, Lee, and we have our center here in Charlotte. We're actually Chris's neighbor. We're around the corner in the promenades where the Winn-Dixie is. So the way the PACE model works is we provide all of your medical care, in-home services, prescriptions, medical equipment, etc. in this program. So the easiest way for me to explain it is just to kind of tell you a story of somebody who's actually in the program. So when we initially enroll somebody in our program, we require that individual to come to our PACE center. Either we start them with what we call 1 or 2 center days. So we kind of have a similar setup like Chris has here. However, in our PACE centers, we also have our medical providers. So when our folks come to our PACE program, that's where their doctor is, their primary care. So if somebody comes, let's just say every Monday and Wednesday to PACE, in the morning, how many of you have seen butterfly buses driving around? Those are my PACE folks. So every Monday and Wednesday, we're going to go to that participant's home. We're going to pick that individual up. They're going to get on our bus. They're going to ride the bus with the same people. When they come to the center, if they're due for, like you guys all go for your annual physicals, blood work, and that things, when you go to your primary yearly, those types of annual things are done on that individual's scheduled center day. So guess what? Caregiver, you didn't have to take your loved one out to the doctor. That is actually the caregiver's respite day, okay, when that individual is with us as well. So when they come in, if they're due for those routine things, we'll do that. We also have physical therapists in all of our PACE centers. So we have a lot of people with balance issues, fall risks, things of that nature, back problems, chronic pain. We will go ahead and provide them with physical therapy while they're in the center as well. They also have a social worker assigned to them. We do provide breakfast, lunch, and fluids and snacks throughout the day. And we have a dietitian that oversees all the food that we serve in this program, because in the last, I'm going to say 4 years, 5 years, now I'm getting people ask me about gluten-free, vegan, and I know that new keto diet's out there. I'm waiting for somebody to hit me up with that one. But nonetheless, we do have 2 dietitians that do oversee the food that we serve in our centers because of some of the medical conditions that our folks have as well. On the flip side of it, it's a socialization program as well. So we provide activities. We bring in chair yoga from time to time. We bring in outside folks that can do some crafts with our people. There's musical entertainment sometimes in the afternoon. We also have a lot of diabetics, and we have a diabetic foot nurse, and I love her. She seems to have been following me this whole week because she travels to all of my PACE centers, and she will clip all of the diabetics' toenails. A lot of you guys have to go out to a podiatrist for that, you know, because it's a little scary to just clip a diabetic's toenails because some of the things that could go on. So that we bring her to our centers, and she provides that service. We also try to bring in a dermatologist on site that can take care of some of the skin issues that some of our folks deal with, but we also do send them out. Trying to think of what else I'm missing. I mentioned the social worker. They have a social worker that's available there
What about their labs, their lab work?
Well, that's what I said, like in their normal routine blood work and things like that. We draw the blood in the center. We don't test it there. We send it out, but we draw it in the center. One other thing I didn't mention is we also have exercise physiologists located in all our centers. I know Chris and some of the other folks mentioned, got to keep those body parts moving. So if we feel somebody really doesn't need full-blown physical therapy, or maybe they're just, because of their cognitive ability, they can't manage doing physical therapy, then we can have them work with, we call them wellness trainers. We can have them actually work with that individual while they're in the center so that they can help to keep their body parts moving. We also do have certified nursing assistants in our center that do help toilet our people. We have a shower in our center because if somebody has an accident, we're not going to send that person home to their caregiver, you know, dirty. We want our folks to go home clean. So if we need to shower in the center, we will do that. Now, here's more of what we provide. So PACE provides all your medical care. So let's say you want to go to a cardiologist, or the caregiver wants the participant to go to a specialist. Anything PACE families want us to provide, and we pay for this care, and I'll talk about that at the end of what after I tell you about the services. But anything anybody in our program wants us to provide and pay for, we're the only phone call they make. So as you hear me explaining the services we do, I refer to PACE as a one-stop shop. So we get someone calling in the center and saying, hey, I want my husband to go to the cardiologist. Well, we may want the provider in the center to see that person first, which would be on their scheduled day when they come back in, to figure out why does the caregiver want this individual to go. Where I'm going with this is we have contracts with our specialists here in Charlotte County, and we actually, if we approve that an individual needs that specialist, we will make that appointment, we take them to those appointments, and they're covered. Everything I'm telling you is covered financially by Medicare and Medicaid, and I'll get into the Medicaid at the end of the services that we share with you. So you get your specialist. We also will provide you with all of your prescriptions. They come to our folks' homes every 28 days. They are dosed out the way you take them. So I just went to someone's house yesterday, and this woman, I'm not kidding you, she had 30 pill bottles on her table. And I said, wouldn't you like to be able to put a real centerpiece on that table? So once I get her in, she's gonna get a little pill box, and they're called pill pouches, and they already have everything pre-dosed for everybody. So that can enable people who have some issues with medication management, that can help with that, okay? We also will provide home health aid services, and I know we heard a lot of home health agency up here today and gave you a lot of information, but what our home health aides will do is they will go to our folks' home and provide assistance or supervision with personal care. They take them grocery shopping or to run errands, and they can do light housekeeping, maybe prepare something that can be popped in the microwave, because we talked about it earlier about how some of our seniors aren't eating properly, okay? So if and when we need to provide the home health aid services, we will do that. We also have an occupational therapist his role is to provide when and if we need to bring any medical equipment in the home. So anything medical equipment-wise, wheelchairs, walkers, oxygen, hospital beds. If you need it, PACE will provide that for you. We also provide you with hospitalization coverage. So if one of our folks ends up in the hospital, we're gonna cover the bill. We also provide vision, hearing, and dental care in this program. So all these services that we provide, we will keep increasing them, and that's how we enable the people we serve to age in place. We also want to help people avoid going in the hospital. So the other thing that I like about our program is we are available 24 hours, 7 days a week. And I'm going to tell you this quick little story, and it's with one of my ladies that's in my Charlotte Pace Center. About 3 Saturdays ago, she called our on-call, and she tells the nurse, my body's burning up. So the nurse is like, do you think you have a fever? She wasn't going anywhere along the line of a fever. She just did not feel right, and that's just what she kept telling the nurse. So the nurse on call said, oh, I think I'd better call the Charlotte Pace nurse, who is actually the one who will go out in the field after hours on weekends if those visits are necessary. Needless to say, Beverly, my nurse here in Charlotte County, went out to Ina's home, and as she's talking to Ina, she says to Ina, you know what? I need you to give me a little bit of urine. Ina had a urinary tract infection. This was on a Saturday morning. Beverly calls our doctor, says Ina has a UTI, that's how we refer to it, calls Walgreens. Beverly goes to Walgreens, gets the prescription, Saturday, remember, Saturday, goes back to Ina's house and gives her prescription. Let's just think about that. If Ina was not in my program, guess where Ina would have ended up? Hospital. Guess where she might have ended up after that? In a rehab. So we, not only did we take care of her and help her not to get more sick, we also have saved some of our Medicare, Medicaid dollars. She never had to leave her house. Thank you. She never had to leave her house. So that's like one of the success stories that I really like to share, because, you know, with this program, we get to know you guys very, very well. Part of that center day is utilized so we can keep our eyes on our folks, besides giving the caregivers that respite opportunity, okay? You heard me talk about it being funded by Medicare and Medicaid. If you are 55 and up to 64, a lot of those folks may not have Medicare. PACE, you can get into PACE, and Medicaid will cover you at 100%. If you are a Medicare recipient, then we're going to do everything in our power, because we need to get you on Medicaid. Because Medicare only provides some of the reimbursement for the folks that join this program. So if you cannot get Medicaid, I just want to share this with you. Roughly the copay monthly to us would be about $2,800. And I know people's eyes go, wow, that's a lot of money. But you have to remember, we provide all of your care in this program in your home and in some of the doctor's offices. But we're not going to keep a ledger and say, oh, Mrs. Smith had 6 hospitalizations, she went to the dentist, she's cut off for the month. That is not the way it works. The funding that the PACE programs get is put into one huge pot, and if it is medically necessary, we are obligated to provide that service, okay? So as far as Medicaid, are you all familiar with Medicaid, the guidelines? No? Okay, I'm going to just throw a couple of numbers out at you, just so you can have the information. When I meet with a family and I want to talk to you about getting on Medicaid, I'm going to ask you, how much money do you, I don't want to know about the caregiver, I want to know about the person I'm trying to get in my program. How much monthly income do you get? It cannot be over $2,313. That's the first check mark that I can help you get Medicaid, okay? The second thing I'm going to ask you, because this is where it gets sticky icky, is how much do you have in liquid assets? I know a lot of my folks, you know, they're married, they do joint banking, that's the common way we do things. So you cannot be over $2,000 in liquid assets. And liquid assets includes whole life insurance. Some people are not aware of that, and I just want to share that with you. So there is cash value on those whole life insurance policies. Term insurance has no effect on it whatsoever. So if you meet those two guidelines for Medicaid, we actually will do your Medicaid app for you. We don't charge you for that. That's just part of the process that we do when we're getting people in PACE. If you are over that amount of money, then obviously the next step that you could do is speak to an elder attorney, or you can go to a Medicaid specialist, and they can better help you protect your assets and maybe help you qualify for Medicaid.
And there's a whole topic on that that we do. Part of what Seniors Blue Book does is we do these educational seminars called SBB University, and I know I don't want you to jump in your car and drive all the way to Estero, but I'm doing one there on next Friday. So it's a pretty common presentation that we do. And just to clarify, if you're close to qualifying for Medicaid, there are a lot of things that you can do to get there. We're not telling you to hide $1 million. That's not the key here. It's if you're really close, you know, there are ways that you can get qualified for that program. Now this is a big one, and there's a lot of different aspects to it. What questions do we have? No one.
Oh, there's one.
Do liquid assets include IRAs?
Yes, he's asking if liquid assets include IRAs, yes.
You were talking
No,
about,
not your home. That's not liquid. Boats, cars, homes are not liquid. But if you sell that and you're on Medicaid, you better buy a new boat, car, or home, because then you're gonna lose your Medicaid.
okay, my understanding is if, I heard you say, if you're close to getting she said, if you're close to getting approved by Medicaid, well, I understand it's a long, long wait and 50,000 people in front of you.
Not with me, we have a designated DCF employee that works directly with PACE. So all of our Medicaid apps go right to her. And that I actually got somebody in my the other thing I didn't tell you is, you know, we're not like a home care agency where you call me today and tomorrow you're in. There's a processing time to get in this program. It's up to 12 weeks, but I actually got somebody in 5 weeks. I'm enrolling her May 1st because we have that dedicated Medicaid employee.
Another thing about the program, and I always like to tag team with Lisa, is that you do actually need to have a need to qualify for the program.
Yes, because I mentioned in the beginning it's for at-risk people that could end up in a nursing home or assisted living. So the common diagnoses we see is Alzheimer's, Parkinson's, COPD, diabetics, I can't manage my meds. Maybe you're just a 92-year-old, hey, I'm getting up there in age and I'm not driving anymore, because the age, obviously age is also a factor too that could you know, land you in a nursing home at some point.
You mentioned that this is a national program, so that means you're in other states as well?
Okay, so we hope that the company I work for, we are not running all of the other 135 PACE programs in the country. The way it works is only nonprofits can open these programs, and Hope is a nonprofit. But if you go out to Colorado, it could be called Shepherd PACE. It will have that PACE name tied to it. Okay. And here's one other thing I'm going to give you all. If you got a pen, I can give you the National PACE's website, because one of the things I didn't mention is you have to be a full-time resident in the county where this program is offered. And that is actually an advantage for us, because we all know here in Florida, we get all of our seasonal folks in here. So our PACE providers are only taking care of our PACE people. So we don't have that issue when people get sick in season that they can't get into our center. But the National PACE website, because if you guys know people up north, you might have one in your county. It's N as in Nancy, P as in Paul, A as in Apple, online.org. And you will be able to, you can just put in your town and you'll see, it'll spit up whether or not there is a PACE program in your county. It's county by county.
Is this a private nonprofit? Or where you mentioned funding, where does the funding come from?
Well, we're actually known, I mean, you know, I know you guys are here in Charlotte. Hope was actually Hope Hospice back in the early 70s. So we started on a lot of donations. That's how the company started. But we don't just do PACE, we don't just do hospice, we do a lot of other things. So that enables us to build the funds so that we can open up these other programs and provide PACE to the people in the 3 counties that we serve. Oh, the website? Yeah. N as in Nancy, P as in Paul, A as in Apple,
G as in Grover,
online, one word, online, O-N,
Any other questions? Yes, ma'am.
Are most of your clients Medicaid recipients, or do you have many that are paying, like you said, $2,800 a month?
Yeah, she's asking me if mostly everyone in PACE is Medicare, Medicaid. I would say 95% of them are, but I do have a good handful of people that are making that private pay to us.
With that private pay, do you also take their secondary insurance?
That's a really good question. She's asking me if we take secondary insurance. No. PACE programs are only funded by, and it's red, white, and blue Medicare, just so you all know. So if you come to me and you're on a replacement plan, we do it. You don't have to do anything. We are gonna put you back on traditional Medicare, and we do not get any funding from private insurances. So in essence, what I tell a lot of my families is you're gonna get a raise in your monthly income, because you no longer need to pay for that supplement, as well as if you are getting the Part B Medicare deduction. My mother gets $135.50 a month out of her check every month. If I put her in PACE, she's gonna get that money back in her Social Security check every month. They're not gonna take it out anymore, because PACE becomes the insurance and the provider under one umbrella.
I gotta pay $230 for the secondary.
You don't need the secondary with our program. You would put that $230 that you're paying back in your pocket.
That's why I switched, because I can't afford the $230, because of my age.
And you know what, I hear a lot of that, and I hear a lot of that, you guys go into that donut hole with your prescription plans. We don't deal with any of that. None of that stress that I see come up periodically every year from the issues with the insurances you guys are on, that doesn't happen with PACE.
Any other questions? I think that you are hungry, aren't you? All right. Well, thank you guys so much.
Thank
Let's
you.
give Lisa a round of applause.
Before we get started with our lunch, I'm going to just pass the mic over here, and we're going to ask Grover to say the blessing for us, okay?